Hi everyone, my name is Shuying Zheng. I'm a fifth year psychiatry resident out of the University of Ottawa, and this presentation and poster was supervised by Dr. Olawie, who is a psychiatrist in the schizophrenia program at the Royal. My poster is titled Ozempic in the Treatment of Antipsychotic-Related Metabolic Changes. The learning objectives today are one, to understand the significance of metabolic syndrome and weight gain for patients with psychotic illnesses. Two, to discuss the current treatment strategies for cardiometabolic syndrome. And three, to talk about some preliminary data on the tolerability and feasibility of using Ozempic or semaglutide to treat cardiometabolic changes related to antipsychotic use. There's a significantly decreased life expectancy for people with psychotic illnesses compared to the average population worldwide. While suicide is one of the primary reasons for the decreased life expectancy, another large part of it is related to metabolic syndrome, which include obesity, diabetes, cardiovascular disease, strokes, myocardial infarctions, etc. The rates of cardiometabolic problems in people with psychosis are 1.5 to 5 times that of the general population, so it's a really big risk factor for having metabolic syndrome. And it's hard to say if the reason for the increase in metabolic syndrome rates is because of the medication side effect or if it's actually an effect of having a psychotic illness or some of the genetic factors related to it. But that being said, our antipsychotic medications do come with significant increases in appetite, weight, and are likely a part of the problem. Thus far, a lot of different medications have been examined as potential treatments for metabolic syndrome. These include metformin, modafinil, atomoxetine, topiramate, aripiprazole, and orlistat is just some I'm going to point out. The only medication that has consistent evidence is metformin. And recently, the glucagon-like peptide 1 or GLP-1 receptor agonists were approved by Health Canada for the use in weight loss. In particular, this includes the ones known as semaglutide or Ozempic or Wegovy. So there is good evidence for the efficacy in the treatment of obesity independent of diabetes. There have been a few small studies on the use of semaglutide in patients with psychotic illnesses. In particular, there was a naturalistic study out of Toronto and some case reports, and these demonstrated it as potentially efficacious, but the evidence pool is still rather small. The design of our study is a chart review of inpatients in the schizophrenia and the forensic programs. We're looking specifically at the patients who have been prescribed semaglutide and are on an antipsychotic at the same time. So the date range was chosen because prior to January 2018, semaglutide was not available in Canada, and the end date is essentially November 2023. So the goal of this is to look at if there are any specific diagnoses, medications, specifically antipsychotics, other illnesses, ages, and then looking as well at the metabolic markers such as weight, BMI, waist circumference, their vitals, HbA1c, fasting glucose, lipid profile, and to see if there was a difference when they were started on semaglutide versus afterwards. So one of the major things we wanted to examine as well was whether there were significant side effects or limitations in the use of semaglutide for these patients. Currently, my study is awaiting REB approval. The goal of it overall is to see if semaglutide is a potential option. So we're really interested in seeing if there's any reasons for discontinuation or side effects, and also to see if there are differences in the metabolic profile from before semaglutide to after. I think looking at the treatment of metabolic syndrome related to psychotic illnesses is a really important avenue moving forwards in managing the morbidity and mortality that come with these illnesses. Currently, the treatments are diet and exercise, which can be very difficult, especially in an inpatient setting and in patients who are taking medications that increase appetite, especially things like clozapine. The only other medication treatment is metformin, which is effective, but it has a small effect size. If we're able to find novel treatments for metabolic syndrome, this could greatly impact the morbidity and mortality of having our psychotic illnesses. Thank you for listening to my presentation, and here is my bibliography.